The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Guys, kumusta naman na kayo? Okay, we're now down to our last 4 subjects. And we're now in IM, my current residency. Okay? So guys, let's see kung kamusta kayo dito. 161. What is the leading cause of CKD? It has always been diabetes. Okay? Guys, medyo malayo ang ating hypertension. Okay, it's top 3. Top 1 DM, pangalawa is GNs. Pangatlo ang ating hypertension for causing your chronic kidney disease. 162. Which is not part of the classic triad of pheochromocytoma. It's actually your hypertension. Dok, ang hirap naman ng tanong mo, ba't hindi headache? So, classically naman talaga, it's really been headache, palpitation, and profuse sweating. Dominant sign lang po ang ating hypertension. It can cause episodic episodes of hypertension. Now guys, for some clinical help here, take note of their categories here. Headache, palpitation, sweating are all subjective complaints. They're actually symptoms. While hypertension is an objective finding, it is therefore a sign. So, pag ganyan, check mo muna yung ganyang classification. Baka naman kasi add-man out pala siya. So, kahit di mo siya alam dito, by add-man out, you can answer this question testmanship-wise. Okay? 163. What SLE, autoantibody, is associated with neonatal lupus with CHB. Guys, if this is not asked in IM, it can be asked in Pedia. It's our anti-ro. This table is very testable for SLE, guys. Okay? Yung mga ating autoantibodies. ANA for screening, the best screening tool yan. Anti-dsDNA for disease activity. Yung mga nephritis, vasculitis. Very useful ang ating anti-dsDNA. Anti-ro is also your SSA. My mnemonic here, ROSA. Okay? So, it is very useful kasi meron siyang Zika syndrome association even in the lupus as well. Ang anti-la, medyo mahina siya for association. But take note, both anti-la and anti-ro has decreased risk for nephritis. So, good thing na rin siya kahit paano. Kasi nephritis is very problematic in SLE. Anti-Smith is only specific but no specific correlations were noted. Anti-histone, guys, it's usually seen in drug-induced SLE. A very testable concept as well for the board exam. Which condition is not found, or rather, which condition is not seen with having clubbing of the digits? It's COPD. Guys, it's a wrong mistake thinking that COPD has clubbing. Wala po sila. But clubbing in COPD would alert you to find a source for the clubbing. Which could be lung cancer or bronchiectasis. And problematic siya kasi bakit? Smoking can cause both COPD and can also cause what? Lung cancer. Kaya you have to know that a COPD patient having clubbing, baka may cancer pala yan of the lungs. Or baka meron siyang bronchiectasis, which is actually also a complication of COPD. Now, let's go to a cascading type of question here. Okay, which can also be encountered in the board exam. 165. On day 3 of admission, a 37-year-old male with pancreatitis had dyspnea. After x-ray was done, may nakita kang bilateral opacities consistent with pulmonary edema. At that time, patient was on mechanical ventilation receiving 40% oxygen. His ABG yielded partial pressure of oxygen of 90 millimeters mercury. What is the severity of his condition? Having a new or worsening respiratory symptoms within 1 week of consult, pasok ka. 3 days, di ba? Having pulmonary edema, having the absence of a left atrial hypertension, as assumed in the case, this could be a case of ARDS, or acute respiratory distress syndrome. And to know the severity of this kind of condition, you compute this value. PaO2 divided by FiO2. Dapat naka pressure ka divided by 0.40. Dapat naka-decimal ka dapat, not percentage. Ang lumabas ay 225 mmHg. And per definition of ARDS, this is a form of mild hypoxemia. So ARDS, guys, can be caused by different conditions. Can be direct lung injury and even states of sepsis and trauma, including pancreatitis, guys. So in pancreatitis, pwede ka makakita ng ganyan. And this is actually a true case. I've encountered in the ward recently. A patient with pancreatitis, biglang hiningal bigla. Nag-ARDS pala si patient bigla-bigla. So guys, ingat ha. So hindi lang pala siya congestion from adequate hydration for pancreatitis. Meron pala siya new onset na ARDS already. Okay? So pasok kasi yung criteria dito for ARDS, diba? And this is my weird mnemonic here. Oh, may pulmonary edema ka na pala. So, oxygenation status, onset within 1 week, absence of left atrial hypertension and pulmonary edema. That is your criteria for ARDS. Now, for your severity, ganito yan, ha? Take note of your less than, more than, and mga equal to. Ang ibig sabihin, guys, kapag ang value ng yung oxygenation ay 0 to 100, mild lang yan. Pero kapag 101 ka na to 200, automatic, moderate ka na. Okay, 200, take note of the values kasi ang sabi, between 100 and less than or equal to 200 siya. Tapos kapag ikaw ay 201 to 300, ikaw ay mild lang. Okay? Sorry, mali pala to. 0 to 100 is severe. Sorry, mali ako na nabanggit. Okay? 101 to 200, that's moderate. Tapos 201 to 300 is mild. After computing your PaO2 over FiO2. Now, if you have ARDS, what is the therapy with the strongest evidence for treatment? The class A recommendation is actually a low tidal volume in mechanical ventilation, defined as less than or equal to 6 ml of the predicted body weight. Kasi more than that can cause volutrauma and barotrauma. Baka mas masira lalo yung lungs ng pasyente. As you can see here, siya lang yung class A recommendation for ARDS treatment. Now, going back to our case, after discussing it with your resident in charge, wala siyang gallstone, wala siyang alcoholic history, pero meron siyang hypertriglyceridemia. Now, the question, at what level of triglyceride can you have onset of acute pancreatitis? It's actually more than 1,000 mg per dl. Ganyang kataas bago ka magkaroon. And true enough, it's actually the top 3 causes of your acute panc. Gallstone ang number 1, followed by alcohol use, and lastly, the top 3 is your hypertriglyceridemia. Other causes are post-ERCP and some are even idiopathic. Okay. Now, going back to your case, pancreatitis nga siya. Tinanong ka ng iyong MRIC, what is the bicep score of the patient? Now, given the data, BN of 20, GCS of 15, series of 1, age of 37, and absence of pleural effusion, the bicep score is actually 0. You have to memorize this, guys. It's a very important triage tool for acute pancreatitis. Okay? And can be a testable question in the board exams. Kasi, if ang bicep score mo is at least a value of 3, you have high risk for in-hospital mortality. So kailangan ka mas mabantayan sa ICU actually. So, 3 letters ang ating ICU. So, this indicates a possible ICU monitoring. Now, how do you treat a patient with pancreatitis? Okay, very good. You have pain control. you have fluid resuscitation, you have nil per orem. Pag okay na, early enteral feeding. But of course, don't give antibiotics. Okay, hindi po kailangan mag-antibiotics sa pancreatitis. Kasama yan. But the most important among all of them is dapat you have early aggressive fluid resuscitation. And ideally, the fluid of choice is lactated Dringer solution. Again, acute pancreatitis, there's inflammation. Therefore, there's actually an increase of your lactate levels. There's lactic acidosis. You have to battle it with your bicarbonate ion so that mas maganda bigay ang LR for this kind of patients. Okay? So that is your cascading question for my exam. So, para in the exam sa boards, hindi kayo magulat if meron man. 170. Which condition or conditions cause or causes relative bradycardia? All of them may cause it. Usually kasi guys, for every 1 degree increase in temperature or fever, you will have a reflexive increase of 15 to 20 beats per minute. But in these conditions, known as relative bradycardia or Faget sign, heart rate may be lower than might be expected. So, kita yan sa typhoid fever, brucellosis, leptospirosis, and viral myocarditis. Drug-induced fever, and even fake fevers. Marami pa yan, but these are the most important conditions. 171, a very important concept in cardio, which beta blocker is not involved in decreasing the mortality of HFrEF patients. Hindi kasama ang tartrate. Only succinate, carvedilol, and bisoprolol has effect in decreasing mortality. Tartrate has no benefit in HFrEF mortality reduction. 172. What criteria dictates a suitable sputum gram stain sample? It's letter D. Dok, bakit? Bakit kailangan mataas ang neutrophils? Bakit konti dapat ng ating squamous epithelial cells? High amounts of neutrophils points to a lower respiratory tract source. So, it assumes na maganda ang sample mo. Mas direct siya kasi it reflects your sputum coming from the lower respiratory tract. Especially if you're trying to rule out pneumonia or a cause of pneumonia. Now, dapat mas konti ang iyong squamous cells kasi, bakit? Squamous cells are found in your oral cavity. So, dapat mas konti siya kasi if mataas ang iyong squamous cells, baka ang source pala niyan ay laway lang. Kaya dapat low lang ang iyong squamous cells pero high ang iyong neutrophils. But take note guys, baka sa exam, if lumabas to, dapat naka-low power field ka, not high power field. So, take note this in the exam. 173. According to the latest guidelines of UTI in the adult management, this drug can be given a single dose for management of acute uncomplicated cystitis. It's your fosfomycin. Guys, only nitrofurantoin and fosfomycin are the primary drug of choice for your acute uncomplicated cystitis. Don't give ciprofloxacin kasi it can cause collateral damage. Kasi your fluoroquinolones can cause an induction of ESBL organisms. It's very selective. It's a multi-drug resistant organism. So ayaw mo bigay ng cipro sa taong may cystitis na benign. Kasi baka mamaya, meron siyang recurrent UTI, baka meron ka ng development of ESBL na kailangan mo nang mag-ertapenem after at ma-admit siya. So reserve your ciprofloxacin for your more complicated forms of UTI. Okay? Take note of this concept. Quinolone should never be a first-line drug for acute uncomplicated cystitis. Pivmesilinam can also be given. Kaso, hindi siya available sa Pilipinas. Kaya hindi siya part ng ating primary antibiotics for uncomplicated cystitis. 174. Melena will occur if the blood has been staying in the GI tract for at least 14 hours. Okay? Take note of this definition of melena. 175. Which drug or drug class is not associated with your prerenal acute kidney injury. It's your amphotericin B. Okay? So, in AKI, you have 3 types. Postrenal, prerenal, and intrinsic. Postrenal, obviously, after the kidney, mga obstruction yan. Pwede ka mag-cause ng AKI. Due to high levels of pressure, ang nangyayari, the GFR is decreased. Diba? As explained earlier, in glomerular hemodynamics for your physio. In prerenal, kapag konti ang volume mo ng blood, and konti ang cardiac output mo going to the kidneys, you will have prerenal injury. It's a problem before the kidney. And kasama din dyan guys ang ating NSAID use, ACE, saka ARBs, and even cyclosporine. Kasi NSAIDs can inhibit prostaglandin. And ACE, and ARBs can inhibit your angiotensin 2. Prostaglandin is important for dilation of your afferent arteriole. Kasi pag nakadilit ang yung afferent arteriole, higher ang yung GFR. And angiotensin 2 is involved in vasoconstriction of your efferent arteriole. Mas vasoconstricted siya. And as mentioned before, in our physio, pag vasoconstricted na yung efferent arteriole, mas mataas yung GFR natin. So if inhibit these metabolites by NSAIDs and ACE-ARBs, ang mangyayari ay magkakaroon ka ng poor eGFR. Now for cyclosporine, it is actually an anti-inflammatory drug. So same banana siya with your NSAIDs. Now intrinsic guys, dito, lahat yun ng mga damage to your nephron itself. Glomerulus, tubules, and even vascular injuries such as vasculitis, hypertension, okay? And your nephrotoxins and infection and ischemia. But guys, take note that NSAIDs can also cause damage to your tubules over time. Okay, lalo na pag chronic NSAID user ka. So, it can still cause intrinsic kidney injury. Therefore, NSAIDs can cause both prerenal and intrinsic AKI. 176. This form of hallucination is mostly encountered in patients with psychiatric illness. It's your auditory hallucination. Psych questions can be asked in IM, so be aware. Of course, yan, it's actually reminiscent of your schizophrenia. Pag mga delirium ka, mostly visual hallucinations. Pag alcohol withdrawal syndrome, usually mga tactile, parang tingin nila may gumagapang sa katawan nila. Sa mga tao may temporal lobe problem like epilepsy, usually before they have their epilepsy, nagkakaroon sila ng parang smelling of rubber. That's a form of olfactory hallucination. 177. How much percentage of TBSA is involved in toxic epidermal necrolysis? It's more than 30%. Okay? So, this is your SJS10 spectrum. Pag 10% ka, less than 10%, that is actually your SJS lang. Pag more than 30% ka, 10 na ang tawag dyan. Ang 10 to 30 ay tinatawag na SJS10 overlap. Now, first for SJS10, funny thing is, ang mortality rate for SJS is around 10%. Pag 10 naman, it's around 30%. Tapos, sa pathology sa Robids, may distinction ang ating SJS10 saka ang ating Ritter disease or your staphylococcal standard skin syndrome. Ang detachment ng ating SJS10 ay sa epidermis-dermis junction. Pero ang ating SSS naman, unique siya. It's at the level of stratum granulosum. Now, for your board exams, take note of drugs that can cause SJS10. Sulfonamides, S, allopurinol, A, nevirapine, N, antiepileptics, A, beta-lactams, and oxycam NSAIDs. So guys, sorry, I'm a Twice fan. Think of a box being held by Sana. Okay, Sana's box. Sana is may bias in Twice. Okay? Wala lang yan. Demonic na yan guys for you. And I use it in IM to memorize your SJS10 drugs that can cause SJS10. Okay? 178, light palmar creases indicate hemoglobin level of less than 80 grams per liter. Okay, it's found in Harrison's and a testable question. It was asked before, guys. So, definition of anemia in males for adult males na non-pregnant is less than 130. Pag adult female, less than 120 naman siya. Pag pale lang siya, na skin sa mucous membranes, baka 80 to 100 na siya. Pero pag below na ng 80, you already have light palmar creases. Nawala yung ating mga creases here. 179 guys, derma. Underwood's light or black light, okay, may nakita kang coral pink fluorescence. Think of erythrasma. Erythrasma is an infection of the intertriginous area, okay, being caused by your Corynebacterium minutissimum. Okay? So, ganyan siya, coral pink siya. If nag-wood site ka naman sa tinea capitis with microsporum infection, may makikita ang yellow fluorescence. In Ecthyma gangrenosum, an infection of Pseudomonas aeruginosa, you can see here, guess what? Pale blue. Pag vitiligo naman, you have your total white. Okay. And last but not least, in IM, involvement of this joint may occur in patients with RA, but is usually seen as a manifestation of coexistent osteoarthritis. It's your DIP. Kasi usually the DIP and PIP, the first CMC, cervical vertebra, lumbar vertebra, hips, knees, and the first MTP, they are involved in osteoarthritis. Pag RA, usually, hindi gaano ang DIP natin. Pero kapag involved siya in a patient with RA, baka meron kang coexistent na osteoarthritis. Kaya siya very important. So that's all in internal medicine. Next is OB-GYN. To be honest, I'm not quite a fan of OB, and I believe OB doesn't love me back. Only my girlfriend na OB loves me back, thankfully. Okay? So question 181, what is the correct sequence of cardinal movements of labor, okay, of a neonate in the occiput anterior presentation? It's A, engagement first, then descent, then flexion, internal rotation, extension, external rotation, then expulsion. Now, you have to memorize this, guys. It's the basic of delivery. Pag magpapanap na kayo, guys, after the boards, or if mag-OB kayo, you have to know this, of course. Now, I found this mnemonic in the internet, might be useful. Every darn fool in Egypt eats raw eggs. So, might be useful, actually. 182, which feature describes mediolateral type of episiotomy? It's actually more difficult to perform. Now guys, how do I differentiate the two? In general, pangit ang mediolateral kasi it's more difficult to perform, has more faulty healing, mas common ang kanyang postoperative pain, mas faulty ang kanyang anatomic results, mas more blood loss, and meron siya occasional na pain pag sexual intercourse ka after. Ang only good thing lang sa kanya is that uncommon ng kanyang extensions. So sa midday mo naman, generally maganda siya. Pero ang pangit lang sa kanya ay yung kanyang common na extensions. That's how I differentiate the two types of episiotomy. 183. The bulbourethral glands of Cowper, of man, is homologous to the Bartholin's gland of females. So guys, you have to know here your basic embryology. Can be as in anatomy or even in OB. And in pedia as well. Na the tubercles, basically sa lalaki, with exposure to your DHT, will form your penis. Sa babae, will form your clitoris. Ang urogenital sinus sa lalaki, magiging yung dalawang glands. Cowper's glands and prostate. Sa babae, magiging siyang Bartholin saka skin glands. Pero ang counterpart ng prostate na makikita sa daluyan ng ihe ay ang ating skin gland na makikita sa daluyan ng ihe ng babae. In contrast, ang Cowper mo, ang counterpart niya ay Bartholin. Okay? Take note kasi urethral, prostate, di ba? ang skin gland ay actually urethral glands din. Sa babae naman siya. Pag ang folds ang usapan, labra minora sa babae, sa lalaki, it forms the ventral shaft of the penis, the penile urethra. While the labroscrotal swelling in guys is the scrotum, while in females naman is labia majora. That is the reason why, lagyan ko ng IM ng konti ha, kapag meron kang renal colic, ang radiation ng pain ng lalaki ay papunta sa scrotum. Sa babae naman ay sa labia majora kasi they're actually homologous structures by embryology. 184, the surge of your estrogen will lead to LH surge. It will eventually lead to ovulation. Hence, A is the correct answer here. 185. What is the recommended daily amount of folic acid for a pregnant woman? Take note guys with a known history of offspring with NTD. Usually kasi, ang binibigay mo ay 400 micrograms of folic acid. Pero if you have a previous history of an offspring with the known case of NTD, okay, ito yung mga ating mga spina bifida, etc., you have to multiply the dose by 10. So we give 4,000 micrograms para hindi ka na magkaroon ng risk for NTD again. And you give it 1 month prior to conception and during the first trimester. Dapat planado siya dapat. So if nalamang buntis ka, habulin mo siya agad dapat. Pero if you're planning properly before pregnancy, kailangan mag-take na si misis mo or girlfriend mo ng folic acid. Okay? Para ensure talaga na meron tayong proper NTD risk decrease. Para bumaba yung risk mo for having NTDs. Okay? Yan. So, D is the correct answer here. Okay, as mentioned, you multiply it by 10. You have 4,000 micrograms. And guys, take note it's in micrograms, not in milligrams. Okay, so take note of those concepts. What is the RDA of iron for pregnant woman? It's actually around 27 milligrams. Okay? Iodine, 220. Zinc is also 27. Vitamin A dapat hindi lalampas ng 10,000 kasi vitamin A na sobra can actually cause teratogenic effects and can even cause early failure of conception. Vitamin C should be around 80 to 85 milligrams per day, which is not part of the triad of ectopic pregnancy. It's fever. Okay? Ang triad ay delayed mens, abdominal pain, and vaginal bleeding. 188. The placenta of the patient perforates to the myometrium. Pag nag-perforate ka na sa myometrium mo, that is actually placenta percreta, a form of a morbidly adherent placenta. Ang akrita mo, this is the endometrium. This is the myometrium. Ang akrita mo, hanggang dyan lang siya. It only attaches to the myometrium. Okay? Yung attachment niya. Pag inside na siya or into the myometrium, inkrita na ang tawag sa kanya. Pero if it perforates the myometrium going beyond it, is now known as placenta percreta. 189. Cervical softening occurs during the first phase of parturition. Guys, don't forget the physiology and the basics of obstetrics. They can be asked in the PLE. Softening tayo kapag phase 1. Pag phase 2, cervical ripening ka na. Pag phase 3 is now cervical dilatation. Pag phase 4 is now the repair. Kasi ang phase 4 mo ay after the delivery of your baby. Pag ang usapan naman ay uterus rather, unresponsive siya during phase 1. Pag phase 2, hinahanda na siya bale. Parang cervical ripening din siya. Hinahanda, nira-ripen na. Pag phase 3, nagko-contract na siya. Pag phase 4, nag-i-involute na ang iyong uterus. So, phase 1 is the quiet stage. Phase 2 is the activation stage. Phase 3 is the stimulation. And phase 4 is involution. Quasi ang mnemonic ko dyan. 190. What form of twinning occurs when cleavage of zygote occurs at around 8 to 12 days of post-fertilization? It's a monochorionic, monoamniotic, monozygotic twin. Okay? Twinning, guys, important siya kasi depende yung separation ng ating chorion sa amnion, okay, kung kailan ka mag-cleave. Pag 0 to 4 days siya nag-cleave, you can have a di-di. Okay, pag 4 to 8 days ka, a monochorionic and diamniotic. Pag 8 to 12 ka, mono-mono ka na. Pero pag beyond 12 days ang twinning mo, you'll have a conjoined twill already. My mnemonic here, guys, for ease of memorization, scab mnemonic. Pag scab, pag 0 to 4 days ka, separate pa ang chorion sa amnion mo. Kaya ka mayroon dichorionic sa diamniotic. Pag next mo na shared na ang chorion mo. So, you only have one chorion. Kaya ka monochorionic, pero ang amnion mo is still separated. Kaya ka diamniotic. Pag 8 to 12 days ka na, shared na ang amnion mo. Therefore, you only have one chorion and one amnion na lang. Pag sadly, more than 12 days ka na, shared body na siya, you have a conjoined twin. 191. What biomarker is usually seen in, what biomarker is usually elevated in dysgerminoma? It's your LDH. So, biomarkers, guys, can be as in patho or in OB, gynae. CA125, epithelio-ovarian tumors. AFP, yolk sac tumor. Thyroxine, struma ovary. Beta-HCG, guys, choriocarcinoma. Of course, your different hormones. Estradiol and progesterone kasi are produced by your granulosa cells. And testosterone and inhibin are both produced by your Sertoli Leydig cells. And lastly, LDH, okay, is elevated in your dysgerminoma. 192. A female went to the gynae clinic due to vaginal discharge. Meron siyang nakitang thin, homogeneous na clear to white discharge. The pH is more than 5.0. What is the most likely agent? Guys, dito pa lang, let's see the possible agent here. Lactobacillus is a normal flora. It does not cause a vaginal discharge. Okay? Pero kapag na-alter ang kanyang flora, baka magkaroon ng proliferation ng iyong Gardnerella vaginalis, causing bacterial vaginosis. Now, always remember, guys, that Candida albicans is what? It's a fungal organism. And fungi loves acid. So, siya lang ang merong low pH. Ang 5.0, mataas na yan. So, hindi nakasama ang ating Candida already. Now, let's talk about the kind of discharge. It's a thin, homogeneous, clear to white discharge. Ang Trichomonas, ang kanyang discharge ay very yellow, greenish. So, doon pa lang, hindi na pasok ang ating Trichomonas vaginalis. The correct answer is your Gardnerella vaginalis. Therefore, meron siyang bacterial vaginosis here, which is not an STI, as mentioned in micro a while ago. So, as you can see, guys, here, candidiasis has 4.5, less than 4.5 na pH, kasi it loves acid. Tapos, it has a thick, curdy, parang cottage cheese ang kanyang texture. Ang trichomonas mo, frothy siya, tapos yellow to green. Tapos, meron kang mga motile na trichomonads. Plus, you also have the strawberry cervix. But, this cervix kasi, it's actually very rare. So, hindi siya lagi nakikita yung trichomoniasis. But, it's a clincher term. Remember, in the boards, the classical presentations are usually being asked. So, don't worry. Pag binigay yan, matik yan, trichomoniasis yan. But take note, guys, these are part of your Amsel's criteria. Okay? For your bacterial vaginosis. Having your homogeneous texture, that's one. Having an amine-like odor after addition of potassium hydroxide. Having clue cells. These are cells containing Gardnerella vaginalis na organisms. That's 3. And having a pH of more than 4.5. Therefore, you have satisfaction of your bacterial vaginosis. 193, the most common overall cause of infertility is your ovulatory problems. Okay? Second lang ang ating mga male factors. 194, the primary and predominant site of pelvic TB is your oviducts, followed by your endometrium and your ovaries. 195, the most commonly reported tumor causing adnexal torsion in women are your dermoids, according to Lentz Comprehensive Gynecology. Kasi ovarian tumors are actually discovered in around 50 to 60% patients with adnexal torsion. So if you have that for a female patient, think of a possible ovarian mass. Usually, ang nagkakos ng mass, ang mass na nagkakos ng torsion ay around 8 to 12 centimeters. Usually, benign naman siya. And mas common ng ating right ovary torsion than your left ovary torsion. 196. Periperium occurs actually 4 to 6 weeks. Okay, from the time after birth. So, the maximum period of periperium, according to your Williams, is 6 weeks post-delivery. 97. After sustaining a traumatic blow to the left breast, there's a contusion beneath the skin. Nawala siya, pero after 2 months, may nakapaka na non-fluctuant lump. The mostly likely diagnosis here is your fat necrosis. Okay? Usually seen after trauma. Ang adenoma mo sa carcinoma mo, hindi po risk factor ang trauma for having breast mass. It's a wrong notion. Now, kaya ako bininugan nito ang fluctuant. Kasi if you have a fluctuant mass in the breast, think of a possible abscess. So, yun. And often, S. aureus ang nagkakos ng breast abscess. So, you must cover that organism if you give antibiotics. 198. What type of leiomyoma, by location, has the highest potential for bleeding? It's your submucosal leiomyomas, for obvious reasons. Kasi one, it's found immediately beneath the endometrium. So, konting laki mo lang sa kanya, madaling ma-distort yung vasculature mo, supplying the endometrium, causing increased risk for AUB. Tapos, it also increases the surface area of the mucosa, leading to higher risk for bleeding. Okay, that's the rationale for increased risk of AUB for submucosal leiomyomas. 199. Besides abstinence, a form of contraception, what is the only method that can also protect the patients having sex from HIV? Condoms. Because it provides a physical barrier between the male and the female or the male to male na people that are having sex. Okay? 200, last but not the least. So, single dose methotrexate therapy for ectopic pregnancy can be given. So, ang tanong dyan is, what is the single best prognostic indicator of a successful one when given to such patients? And according to Williams, it's actually low initial beta-HCG of less than 1,000 milli-international units per ml. So, the classic predictors of a successful therapy for ectopic pregnancy are A, B, and C. All of them. Pero ang pinaka-best sa kanila is this one. Having low levels of beta-HCG levels. That is all for your OB-GYN. So guys, kamusta kayo? Hopefully okay pa rin. Last 40 items na lang tayo and we're now done with our rationale for your diagnostic exam in top notch. So guys, tisa lang tayo. I'm hoping na marami kayong natutunan so far. So with that said, let's now go with pediatrics. Okay? 201. What is the most common type of esophageal atresia and tracheoesophageal fistula, TEF? It's actually letter B. Esophageal atresia with distal TEF. Now, meron siyang proper typology. A, B, C, D, E, or H. Pag A mo, you only have the atresia. Pero wala kang involvement na TEF. Pag B mo, meron ka ng EA dito automatically, tapos meron kang proximal na TEF. Pag C, ang TEF mo sa distal lang. Pag D mo, proximal and distal na. So guys, may kwento yan. So, yung mga classification, may mga kwento yan usually. So, usually, gawa mo siya ng kwento para hindi ka mahirapan mag-memorize. Tapos lastly, ang E mo, kakaiba siya. Kasi wala kang atresia, you only have here a fistula. So dito guys, papansinin mo, E siya, pero isang tawag sa kanya ay H kasi para siyang letter H here. Kaya ang isa pang tawag sa type E ay type H. Now, for a corny mnemonic na naisip ko back during my time is, of review is, CAH, di ba? Meron ba siyang congenital adrenal hyperplasia? Di ba? So yun lang, para lang ma-memorize mo yung frequency ng ating different varieties of your EA and TEF. 202. Which condition is a major risk factor for recurrence of febrile seizures? Febrile seizures is very prominent in the pediatric population. So, you must know the risk factors involved kung kailan siya baka mag-recur for optimal management. Hence, this is actually clinically important. Now, baka you'll answer A, but actually, sabi ni Nelson, is actually D. Duration of fever less than 24 hours. So, siya isang major risk factor. Minor lang po ang family history as well as a complex febrile seizure. Okay? 203. The most common life-threatening emergency of the GI tract in the newborn period is your necrotizing enterocolitis. For obvious reasons. Kasi, yun nga, it can cause pneumoperitoneum. Ang mangyari kasi dyan dito, if you have necrosis of your GI wall, nangyayari, nagkakaroon ka dyan ng gas formation. So, kasi may mga bacteria, di ba? So, nangyari doon, nagsikit sila ng gas. And can lead to your salient finding of pneumatosis intestinalis. Tapos, ang mangyari dyan, pag pumutok siya, it can lead to pneumoperitoneum, which means you have air inside the peritoneal cavity. Sign of severe NEC, having a portal venous gas, and the major risk factor of NEC is your prematurity. So, bantayin niya sa mga taong premature. Okay? 204. So, guys, in pedia, marami ang development milestones, okay? Kung kailan na malabas, so you have to know this. A patient can stand, can perform a pincer grasp, playing a peekaboo, and imitating sounds. So, at least, ang age niya ay probably around 9 months. Okay? A pincer grasp, okay? Kahit din na mabasa mo, automatic guys, it's 9 months. And sabi ni Nelson's, it's 9 months for your neurologically important milestones. 205, let's talk about precocious puberty of central origin. Kapag females, ang definition dyan ay dapat before the age of 8. Pero pag males, ang definition dyan ay dapat before the age of 9. Okay? So, paano mo masasabi na meron kang testicular development? Defining volume niya is dapat at least 4 ml siya. Pag naging 4 ml na ang testicular volume ng ating males before the age of 9, you have central precocious puberty. 207. Okay? Before that, I have to say pala that the most common cause of central precocious puberty in males is actually organic problems of the central nervous system. 207. A patient having sepsis, IJV thrombophlebitis, and pulmonary abscesses after untreated sore throat infection. This is actually a triad known as your Lemierre syndrome. Pag meron kang ganyan, the probable agent is an anaerobic bacteria known as Fusobacterium necrophorum. Okay? This is a very testable question in the PLE. 208. Okay, so in the adult population, the most common cause of CAP is S. pneumoniae. But in the pediatric population, pabago-bago po yan. Pag ang most common cause in a patient of at least 5 years of age, meaning 5 pataas, It's actually Mycoplasma pneumoniae. Okay, pag neonates ka, less than 3 weeks of age, GBS ang most common cause ng pneumonia. Pag 3 weeks hanggang 4 years old, RSV po or virus ang mas nagkakos. Okay, RSV natin. Pag at least 5 years and above, up to the age of 18, ang pinaka most common cause po ay pneumoniae. Pero pag 18 and above ka na, ang most common cause na ay pneumoniae. 209. So, the recommended standard of care for treating pediatric patients with acute AGE, or AGE rather, is using a low osmolarity WHO ORS. Now, dahil low osmolarity siya, what would be the total osmolarity of this regimen? This was asked before, and the correct answer was 245 milliosmoles per liter. Ang tanong, what are the components of this ORS? Sodium mo 75 at ang chloride ay 65 only. Tapos 20 ang potassium mo, and mababa ang iyong glucose, only 75 lang siya, leaving you with citrate of 10 millimoles per liter. Total of 245 milliosmoles per liter. Now, how to memorize this? Kailangan laging 1:1 ng ratio ng sodium mo sa kanang glucose mo para maging effective ang iyong increase in absorption of sodium. Kasi kailangan mo ng glucose-sodium transporter here. So, nangyari dyan, dapat 1:1 sila. So, pareho 75 po ang sodium siya glucose natin. Usually, ang chloride ay same with sodium. In this case, hindi konti. It's 65 only. Ang discrepancy kasi, meron kang 10 millimoles na binibigay for citrate. So, yun pa lang, alam mo na yung components niya. Okay? Now, overall in all, you only have 225. So, ang remaining 20 millimoles mo is being provided by your potassium. So, guys, gawan niyo ng kwento. May kwento yan for every figure and every table. So, find the kwento in those study, those important lecture points para madali silang ma-memorize along the way. Okay? 210. Okay. So, a 10-year-old male with 6 days of fever already. Upon PE, you have a bilateral non-exudative conjunctival injection with limbal sparing. You have erythema and edema of the hands and feet, a maculopapular rash, and a left unilateral non-suppurative cervical lymphadenopathy of at least 2 by 2 centimeters. Now, ang tanong dyan muna is ano ang sakit na to? This could be a case of Kawasaki disease. Now, if magkaka-complication ng Kawasaki disease mo, the most commonly involved artery is your coronary artery. So, this is the definition for Kawasaki disease. Absolute na criterion ang fever of at least 5 days that is very persistent. Tapos, you should have at least 4 principal features. Changes in extremities, a polymorphous exanthem, a bilateral bulbar conjunctival injection without exudate, meron kang mucosal changes, including the strawberry tongue, and having a cervical diameter, having a cervical lymphadenopathy of at least, of more than 1.5 centimeter in diameter. That is usually unilateral. So, at least 4 of those meron ka, plus your absolute criterion na fever of 5 days, baka meron ka ng Kawasaki syndrome already. And this actually is a very important leading cause of acquired heart disease among pediatric patients in the developed countries. Okay? Kasi pwede siyang mag-lead to coronary artery aneurysms. 211. So, this is under embryology. External genitalia of the fetus becomes very obvious at 12 weeks AOG. Pag-uusapan ay internal genitals, it usually occurs at around 8 weeks AOG. This was actually asked before during our time in the PLE. 212. What primitive reflex develops at around 7 to 8 months postnatally and remains throughout life? it's actually your parachute reflex. This reflex is actually evoked by holding the infant trunk and lowering him or her as if he or she were falling. So this is actually a reflex that is actually useful as a prerequisite for walking. So guys, testable na naman siya. Kasi the rest of the primitive reflexes nawawala except for parachute reflex. So take note of this testable odd man out concepts. They're usually testable in the exam. 213. What is the most common defect of the cardiac system in Down syndrome patients? It's your endocardial cushion defect. For Turner syndrome, it is always your correctation of the aorta and the bicuspid aortic valve. Now, we also have your Williams syndrome. Ito is ang common cause of, not common pala rather, but a prominent cause of hyperglycemia in infancy and also having Elfin fascies. So usually, they have a supravalvular aortic stenosis. A very famous na teratogen, lithium given in the prenatal time can cause Epstein anomaly. Morphan can lead to MVP. Down syndrome can lead to your endocardial cushion defect, also known nowadays as AV septal defect. Pareho lang po yan. And the infant of a diabetic mother can lead to TGA and even VSDs. 214. The most common cause of central precocious puberty na brain lesion ay hamartomas of the hypothalamus. Kasi ang nangyari sa kanya, there was actually an increase in TGF-alpha which then actually causes the activation of the GnRH pulse generator. Napapaaga yung kanyang GnRH activation. So, nangyayari, bata ka pa lang, nagkakaroon ka na ng early developments for sexual, for secondary sexual characteristics, hence having the precocious puberty definition. 215. Okay, so this was actually asked before. Which statement is false about hypertrophic pyloric stenosis? Tama po ang A. Usually, siya ay associated with erythromycin use in neonates with highest risk of medication kapag binigay siya during the first 2 weeks of life. So, check. Non-bilious vomiting is the initial symptom, correct? And dahil suka ka ng suka, the usual abnormality is having metabolic alkalosis kasi you're actually losing here acid eh. So, nangyayari, nagiging metabolic alkalotic ka. Tapos, you're losing here potassium and dahil wala kang HCl, you're having here hypochloremia. So, tama ulit. If you're confident with the first three, you may answer D as the correct answer by odd man out. So, D is actually the correct answer here. Kasi vomiting usually occurs here at 3 weeks of age to as late as 5th month. So, hindi siya agad nagpapakita. Medyo late siya ng konti. Now, the next question is, what is the surgical procedure of choice for hypertrophic pyloric stenosis? It's a Ramstead procedure. Now, guys, sa panglalaki nito ng konti, pwede mong isipan si Derek Ramsay na macho. Okay? Derek Ramsay, di ba? Hypertrophic, pare, di ba? Batak. Okay? Hypertrophic siya. Okay? Derek Ramstead procedure. That's my mnemonic here. My visual mnemonic. Okay? You may use this for your own mnemonics. Ang LAL procedure, guys, is for malrotation. Kasay naman is for your congenital biliary atresia. And Nisa naman for GERD and hiatal hernias. Basta guys, pag hypertrophic pyloric stenosis, think of Derek Ramstead procedure. 217. A VCUG was done yielding a grossly dilated ureter but no tortuosity and loss of papillary impression. The grading of the reflux is at least grade 4. Pag grade 1 ka, hindi po dilated ang ating ureter. Check. Pag grade 2 ka, umaabot siya sa ating upper ureters, pero hindi siya dilated. So, check. Pag grade 3 ka, meron ng blunting ng ating calyceal fornices. Pag grade 4 ka, ang tawag sa kanya ay grossly dilated ureter. Pero, pag grade 5, doon na nagkakaroon ng loss of papillary impression tsaka tortuosity. Timo, mas nagkakaroon siya ng tortuous na ureter. So, doon lang siya prominent. Continuing with pedia urology, the most common obstructive lesion of the urinary tract in childhood is your UPJO, the obstruction between the ureter and the renal pelvis junction. Pero the most severe is your posterior urethral valve obstruction. Ito most common, pero the most common cause of severe obstructive uropathy in children is having posterior urethral valves. Now, in some pedia exams, usually, merong konting halong pathology. Kasi nga, tumors in the pedia population is very prominent, di ba? It's very remarkable, kumbaga. Now, in this case, a 3-year-old female with the mass at the right hemi-abdomen that does not cross the midline. It's only found at one side. Pina-UA siya, may nakitang hematuria. And imaging showed a large mass in the right kidney. So, doon pa lang, may idea ka na baka ito ay isang Wilms tumor or nephroblastoma. Pareho lang po yung terms na yun. Kasi the mass does not cross the midline. Now, ang tanong, what is the expected finding in Wilms tumor? Is there triphasic tumor of blastemal, stromal, and epithelial components? Homer right pseudorosettes is a lesion seen in your neuroblastoma. Flexner Wintersteiner rosettes are seen naman in your retinoblastoma. While your small round blue cells can be found both in neuroblastoma and Wilms tumor. And hindi lang po doon, they can also be seen in numerous conditions. Ewing sarcoma, medulloblastoma, rhabdomyosarcoma, crystal sarcoma, etc. They are known as your small, round, blue cell tumors. Now, a while ago, I highlighted that in nephroblastoma, hindi po nagko-cross ang kanyang lesion midline. Kasi usually, if nagko-cross midline ang ating mass, it could be neuroblastoma. But of course, this should be confirmed under imaging. Okay? So that's the main difference of Wilms tumor and neuroblastoma clinically and histopathology. Lastly, in pedia immunology, a 9-year-old male with known peanut allergy accidentally had some at the school canteen. He developed difficulty of breathing and having weak pulses. Epinephrine of 1:1000 dilution is recommended to be administered via the intramuscular route at the anterolateral thigh at supine position. That is the best means, okay? Better ang IM than SC. So, tanggal na siya agad. Kasi, mas merong bioavailability pag binigay ang epinephrine via the intramuscular route. Tapos, mas maganda siya sa ating anterolateral thigh. And dapat naka-supine position ka. Kasi, pag binigay mo siya in the sitting position, baka magkaroon ka ng insufficient return of blood to the heart. So, dapat nakahiga ang ating pasyente to increase her venous return after giving epinephrine. Ang tawag doon sa problema kapag binigay mo ang epinephrine for anaphylaxis sa tao na nakaupo, ang tawag doon ay empty heart syndrome. So guys, take note of this kind of syndrome can also be as in internal medicine. So, this is the proper way of managing anaphylaxis. Now, we head to our last subject. Okay, we're now at the last subject, at the last day of your PLE. Your preventive medicine and public health. 221. So, a sample of Caviteños were telephoned and asked how much they exercise each week and whether they have or have ever been diagnosed with heart disease. No follow-ups were done. What is the study design being implemented in this case? This is actually a snapshot of the exposure and outcome in the sample of Caviteños. No follow-ups were done. No history keeping or review of records were done here. It's only a snapshot. This is actually cross-sectional study. Hindi siya RCT kasi wala kang follow-up, there's no experimentation. Sa cohort, you're not following up anything. And hindi siya case control kasi there's no review of records here. Okay? So dito, pag cross-sectional study ka, the parameters derived here is actually prevalence. You'll have an idea of the prevalence here, but you can't derive odds ratio and relative risk incidence here. In the case control, mas ginagawa siya sa mga rare disease, sa mga cancer. Kasi konti yung mga kaso mo, so you can't follow a population. So cohort can't be done in rare diseases. So in a case control, you can have the odds ratio as the parameter derived. In a cohort, you want to test here the effects of a cause over time. So you're following up a patient over period of time. So dito, ang nakukuha mong value ay tinatawag na relative risk. And you can also deduce here the incidence of a disease. 222. According to the Sanitation Code of the Philippines, or PD 856, disinterment of remains of a person who died of a dangerous communicable disease may be granted after a burial period of 5 years. So, interment or burial, pareho lang yun. Nilibing mo yung isang pasyente na namatay. Disinterment ay ihukay mo siya palabas. So, kapag dangerous ang ating nakakahawang sakit na kinamatay ng pasyente natin, 5 years pa bago siya pwede ma-disinterment. Pero pag non-dangerous ang ating cause ng sakit, by law, allowable na siya after 3 years. Sa mga COVID patients natin guys na namatay sadly, 5 years pa sila kasi category siya as under a dangerous communicable disease. So if you want to change the burial site of a relative or a friend na namatay sa COVID, kailangan 5 years pa bago mangyari yan. Now, some first pa for your Sanitation Code of the Philippines, kailangan ang water source ay dapat at least 25 meters away from sewage tsaka factories. Saka at dapat, pag burial ground, dapat 50 meters away siya from a water source para hindi ma-infect ang ating mga water sources. Dapat din, pag nagpalibing ka, dapat 1.5 meters siya from the surface. Pag ang isang remain ay hindi na embalma, kailangan malibing siya within 48 hours. And kapag meron kang dangerous na communicable disease, dapat malibing siya within 12 hours. And only adults can attend. Kaya mga pasyenteng may COVID, kailangan malibing siya within 12 hours by law. Okay? 223, the family genogram. So may family din po in Prevmed. What symbol is used to designate spontaneous abortion? It's triangle. Pag square, male sex ang ginagamit natin dyan. Circle pag female sex. Pag hindi ka sure sa history mo, if ano ang sex ng kanyang family member, diamond ang ginagamit natin. Pag nagka-spontaneous abortion, yung family member ng ating index patient, triangle ang ginagamit natin. Pero kapag tinerminate siya, okay, kailangan lagyan ng slash above it. And always remember na kailangan maglagay ng arrow sign pointed to the index patient. Siya yung pasyente na involved sa ating disease. You're just asking for the family history of that patient. Okay? 224. Now, this is under occupational health. A 24-year-old female underwent her APE as prescribed by her company. She has error of refraction and wears eyeglasses to correct it. What is her patient classification? Isa siyang Class B patient. So guys, for those who plan to do moonlighting after and magpapa-APE kayo, okay, kailangan yung alam tong classification na to. A is always fit for any work. B, kapag meron kang error of refraction, nadalcaris, defective hearing, and other similar defects. Pero fit to work ka pa rin. Ang B mo, employable ka pero meron kang mga strong na comorbidity like heart disease, defects, hypertension. Therefore, kailangan mong malagay to a special placement or limited duty ka lang pwede. Ang Class D is automatic na unfit for work. Usually, kapag meron kang advanced heart problem, if you have active PTB, you have malignant hypertension, kailangan mo munang maging unfit for work. Kasi baka ikaw ay makahawa for TB or baka ikaw ay magka-complication for your heart failure. 225. Which condition does not mandate prolonged IV antimicrobial therapy? This is important for your antimicrobial stewardship program by your Department of Health. So, okay lang po na matagal ang ating IV antibiotics for the febrile neutropenia. Kasi you have to cover a lot of microbes, 'di ba? Can cause fever in the immunocompromised state. Automatic na matagal ang ating therapy for osteomyelitis since matagal ang bone penetration ng ating mga antimicrobials. And endocarditis really warrants long antimicrobial therapy. But bacteremia due to P. aeruginosa does not merit prolonged IV use unless ang cause ay S. aureus. Pag S. aureus ang yung bacteremia, allowable na meron kang prolonged IV antimicrobial therapy. 226. According to DOH calendar, the mass drug administration for schistosomiasis is done every month of January. Same siya for the first MDA for STH. Pero ang STH mo kasi, twice a year mo siya binibigay. It's biannual. January and July siya ginagawa. Tapos, ginagawa naman ang ating MDA for filariasis every month of July. 227. According to the MMDA Ordinance 99004, the color-coded container for your pathologic waste is yellow. Okay, guys we've done your internship. So, dapat ang mga ating pathological waste tinatapon sa ating yellow na container. Red for hazardous, yellow for pathologic, green for biodegradable, and black for non-biodegradable waste. 228. According to WHO, which condition is a water-based disease? So this was asked before. It's actually schistosomiasis. Medyo weird yung question na siya kasi medyo out of this world siya. It's actually this category. Waterborne kapag ang infection ay nasa-spread via contaminated drinking water like diarrhea and typhoid fever. Water wash kapag ang dahilan ng spread ay lack of sanitation and hygiene. Ang example sa sinabi ni WHO sa kanyang document ay ascariasis sa hookworm. Okay, this is a document actually from WHO. Pag water-based ka na sakit, ikaw ay uniquely tinatransmit ng isang aquatic invertebrate organism. Ascaricaria for your schistosomiasis. Automatic yan, water-based ang ating schistosomiasis parate. While vector-borne, kapag ang mga insects na naging vector ng sakit ay kailangan ng tubig for their propagation. Like mga mosquito-based insect na illnesses, malaria, filariasis, onchocerciasis, and your Japanese encephalitis. 229. Which triage color is used for victims whose injuries are so extensive that they will not be able to survive given the care that is available during emergency? It's color black. Pag hindi naman kailangan ng any help, white sila automatically. Pag expected na mamamatay na sila given the available care at that time, or patay na sila, you give them a black triage color. Pag kailangan talaga ng emergency and kaya sila mabuhay, you may provide a red tagging. Para sa mga taong may injury pero nakakalakad naman sila and pwede pa makahintay, green code ang binibigay sila. For those na kailangan ng observation pero hindi kailangan ng immediate care at hindi nakakalakad, they are yellow tag. So take note this triage coding for emergency 230. Measures were done at the tertiary hospital to prevent over-medicalization among its patients. What is the established level of prevention? This is actually known as quaternary prevention. So there are actually 5 levels of prevention: primordial, primary, secondary, tertiary, and quaternary. In primordial, it's actually a community-based intervention. Primary to tertiary is actually patient-based, while quaternary is actually a hospital-based management. Sorry for my handwriting. Napagod na ng konti. So, in the primordial, you remove the risk factors and agents in the community, may it via a law or a possible administrative order in the community. Now, in the primary, at the patient level, gusto mong hindi ka magkaroon ng sakit. So, you target it at the pre-disease stage, bago siya magkaroon ng sakit, for example. During secondary prevention, nasa latent stage ka na. Meron ka ng cause for the disease, pero hindi ka pa nagkakaroon ng clinical manifestations. So with that, you provide a secondary level of care. Pag tertiary, you provide care kapag meron ka ng sakit but you want to prevent complications that can lead to further problems such as disability in the future. So you provide a tertiary preventive measure. Now in quaternary, binibigay mo siya para hindi sumobra ang paggamot sa isang pasyente, hindi siya mabigyan ng unnecessary na medical invasion. So for example, nabigay ka ng unnecessary na surgery for a patient na naka-admit sa hospital. So, you want to promote your ethical na clinical management. Ang tawag dyan ay quaternary level of prevention. Okay, take note of this concept in Prevmed. 231. A new anti-DM drug was developed by a company. So this drug is actually effective in decreasing your HbA1c levels by at least 2% after 3 months of medication use. At present, the drug is at the post-marketing surveillance. Therefore, the drug is currently at phase 4. So there are actually 5 stages of drug development. Pag mga lab animals pa lang siya, ang tawag ay preclinical stage. From phase 1 onwards, tao na ang ating subjects. Pag phase 1, normal subjects lang ang ating population. Wala silang mga sakit. You want to know here the dose response of the drug and the pharmacokinetics. Pag phase 2, ginagawa siya sa mga taong may sakit. Kasi gusto mong malaman dyan ang kanyang desired efficacy. Most drugs fail at this stage. Pag phase 3 na, ang population mo ay still the diseased subjects, pero you're now comparing it with different trials. It's a multi-center trial, and usually, you may have a double-blind crossover design. Usually, at this stage, nagkakaroon ka dyan ng mga immunological problems. Diyan sila nakikita. Kaya siya important pa rin. And lastly, phase 4 is post-marketing surveillance. Ito yung minimonitor mo pa rin yung drug even after nasa market na siya. Kasi baka may mga side effects na hindi nakita during studying of the drug. So, para ma-recall mo siya from the public as soon as possible. Kaya important ang ating phase 4 of drug development. 232. What is the most effective control measure for modulation of noise in the workplace? Choose the best answer. Always, the best means of control for a risk factor in the workplace is elimination of the source of the problem. That is based on the hierarchy of controls by the CDC. Elimination muna bago mag-substitution. Kasi pwede mo siyang tanggalin mo na siya if di naman kailangan. If kailangan niya magstay, baka find an alternative that is very less harmful. Pag talaga matanggal, mapalitan, you must have engineering. Like a physical barrier, for example. Pag hindi pa rin talaga pwede, baka kailangan mong i-minimize yung contact ng tao dun sa source natin of problem. One way is via administrative control. Usually, yung ginagawa dyan, iba yung rotation mo. Like day 1, dyan ka muna, dito sa iba ka naman. To lessen the exposure of the people in the workplace. Pero pag hindi siya applicable, like for example, as doctors, medyo malabo pa siya this time, PPE tayo to provide protection from the hazard. 233. Which drug is not a restricted antimicrobial? Restricted, ito yung mga binabantayan ng ating mga antibiotic stewardship program in the hospitals. Meaning, hindi sila basta-basta pwedeng ibigay unless pinaalam mo to an AMS official in the hospital. So, obviously guys, A, B, and C ay mahirap ibigay. Ang C ay isa lamang siyang monitored na antimicrobial. It's not a restricted antimicrobial. So, monitored ang mga third generation na cephalosporins, mga ceftriaxone, lahat ng quinolones, lahat ng aminoglycosides, and clindamycin. The rest are restricted. Fourth generation cephalosporins, aztreonams, mga carbapenems natin, colistin, vancomycin use, linezolid, all IV antifungals except your fluconazole. While the rest are not monitored and restricted by your antimicrobial stewardship program in the hospital. 234. As of 2022, the leading cause of mortality in the Philippines is still ischemic heart disease. Guys, this is still being asked, okay? So, kailangan alam nyo pa rin yung gantong concepts in Prevmed. 235. According to the U.S. Preventive Services Task Force, mammography with or without clinical breast examination should begin at the age of 50 years of age and every 2 years. So, ayun guys, ginagawa siya at 50 and every 2 years. So, this is the one found in Harrison's. Okay, it's a very good table here. And it's very useful. But nowadays, guys, for cancer, binaba na yan. From 50, 45 na po siya so far. Okay? Especially in the US. 236. What is the recommended daily calcium intake in mg per day among men and women of 51 years and older? It's actually 1.2 grams or 1,200 milligrams per day. So, this is the adequate calcium intake for your different populations. Pang young children na 1 to 3, 500 lang. Pag 4 to 8, 800 lang sila. Pero pag adolescents guys, to yung adults, papansin mo mataas siya. Kasi this is a point na mataas ang kanilang growth rate due to puberty. So, they have an increased demand for calcium. Pag after ng adolescence mo, pag adult ka na up to 50, bababa yan to 1,000. Pero pag matanda ka na, beyond 51, kailangan to na ulit kasi you have a higher risk now for osteoporosis. So may kwento ulit yan guys. So take note of the trends in calcium intake. 237. According to DOH, which is not part of the newborn screening program in the Philippines, it's cystic fibrosis. Kasi it still remains to be a major public health problem in developed countries. Okay, yung ating cystic fibrosis, very rare siya sa Pilipinas unless meron silang, unless may mga foreigners involved sa ating bansa. But per law, so far, ang pinapayagan pa lang ay 6. Dati, 5 lang yan. Ito lang, ito, tsaka ito. Bago lang tong G6PD. Kasi nalaman na marami rin pala sa Pilipinas and kailangan siya mabantayan kasi if you give some drugs to G6PD patients, baka pwedeng makatrigger siya ng hemolysis. So, kasama na siya sa ating newborn screening. And newborn screening is actually RA 9288. So far, pwede ka naman magpa-cystic fibrosis testing pero hindi siya kasama sa basic package natin. You can avail it sa ating expanded package which contains 28 and more diseases. Usually, these are metabolic problems. Yung ating mga newborn screening testing. 238. Which relative risk value indicates that the exposure has protective effect on the outcome? Dapat less than 1 siya. Lagi siyang protective lagi for RR. Pag more than 1 ka, harmful ng kanyang effect. And same banana sa ating odds ratio. Okay, sa odds ratio natin, which odds ratio indicates a lower likelihood of the outcome among individuals exposed to the factor being studied. It's still less than 1. Okay? Laging 1 ang ating reference point for both RR and OR. Take note of that. And last but not the least, guys, congrats for reaching this point. Take note that in public health, you must be familiar in the different DOH programs and policies existing nowadays. So in this population, guys, ano ba ang involved sa ating Operation Timbang Plus program? It's actually children below 5 years of age. Sila ang target population for our Operation Timbang Plus. So that concludes our rationale for the diagnostic exam here at Top Notch Medical Board Prep. Thank you for listening my lecture. I hope this will be helpful for your preparation. Remember, your dedication and hard work have brought you to this point. Huwag kabahan, stay focused, stay confident, and trust in your abilities. So with that, I leave you with this message. Don't quit. Okay, guys, always remember you are doing well. So stick to the fight when your heart is hit. It's when things seem worse that you must not quit. So guys, kaya ko yan. See you in the next sessions. Good luck with the board exams. Don't quit.